Hi, my name is Dr. Richard Savell,
And I'm Dr. Cindy Monroe.
and we're the co-editors-in-chief of the American Journal of Critical Care. We've put together this instructional video for you, the potential author at AJCC, so that you can successfully go from having an idea for a clinical research project and take it all the way through to having your article successfully published in the American Journal of Critical Care. We go through some of the important points that might prevent you from being successful, because we want you to be successful in your experience publishing here with us.
One of the most important pieces in doing research and in publishing research is to find a good mentor and to work with that person. If you were going to learn a new skill on the critical care unit, you wouldn't just go to the bedside and give it a whirl. You would find someone who really understands that procedure and knows how to do it and has expertise. And that's what you want to do in a research project and in publication as well. Find someone who has done research, who has published research, and get them to walk you through the process as you go along.
In this next section, we're going to speak about study design. This is a very important part of having a successful experience when you submit to the American Journal of Critical Care. Study design is absolutely crucial and is different from having a good idea for a clinical research project. It's very important, as Dr. Monroe and I have both had multiple examples where a good idea was submitted to us, but because the study design wasn't what it needed to be, we really weren't able to send it through the peer review process. We both strongly recommend that after you have your initial idea and you work with your mentor and colleagues, that you spend significant time to focus in on quality, high-end study design. There are multiple right answers here, and it really should be mapped closely to your particular patient population as to whether you decide to go with a randomized trial approach, whether you're going to be using an approach of a cohort study or a case control study, or even more complex analyses that can be performed as part of your study design. But the big picture take-home message here is that time spent on study design is time well spent.
In order to publish your research, you must have Institutional Review Board, or IRB, approval. You really want to work with your IRB at the beginning of the project before you begin to collect any data at all to obtain their approval. Sometimes the IRB will tell you that it's okay to proceed without any special requirements for consent, but you want them to make that determination. Don't make it on your own. Once you've obtained your IRB approval, you can then begin doing the project. But if you don't have IRB approval in place, we will not be able to publish your manuscript.
In this next section, we'd like to focus in on the overall structure of the manuscript. The way we would like it submitted here at AJCC is the standard introduction, materials and methods, results, and conclusion. I'd like to talk a little bit about each section. And it's important to remember that as you start to get into it, you almost certainly won't actually write the paper in that particular order, because as you start to gain data, as you start to go over your results, as you start to do your analyses, that part of the paper will be fleshed out first. But going over it in order, your introduction, one of the things we've seen is that the introductions are too long. The introduction really should be 3 focused paragraphs. 1 focused paragraph on the background of the study or the problem. 1 paragraph focusing in on a particular sub-area which is leading up to the 3rd paragraph, which is where you, as the author, explicitly describe what you're doing in this particular study and why you're doing it. Your materials and methods section is an absolutely crucial part of the manuscript, and we strongly recommend that you consider putting in sections in the materials and methods where you discuss what you did, and you go over in great detail exactly the methodologies you used. This is where you're going to put in your IRB approval and your informed consent, and where you go through exactly the protocols that you did as part of this manuscript and this study. It's important then, after you've done your introduction and your materials and methods, that you focus in on results. This is the entire meat of your paper. And again, making subsections, making headers, you are fully at liberty to do that, and it helps the reader understand where they are if you do that. The results section can be somewhat intimidating for first-time authors because it's important that you figure out how much of your results need to be actually put in the manuscript. And we strongly recommend that you make liberal use of making reference to your tables and figures throughout your section, your results section. The discussion, this is where you, as the author, have the opportunity to take your newly minted results and place them in the context of the rest of the literature. So first of all, it's very important that you've looked carefully through the rest of the literature so that you can say our results are in agreement with X, Y, and Z authors, but they're different from these authors, and here's why we think they're different. It's very important, again, that your discussion section be most of the time shorter than you think it needs to be. Go over in your discussion section in the beginning, state clearly, so, in summary, our results describe X phenomenon. Then focus where you agree with certain articles in the literature and disagree with others. Then focus in on what you think the strengths and weaknesses of your particular data is, and then make a summary statement at the end that, so to describe again, we have shown in our article that this and this data is true, and that future studies clearly are coming out of our data based on this important research.
As you're preparing your manuscript, think about what data could go into tables and figures. Tables and figures are a really wonderful, concise way to present your results, and it's much easier for your readers to look at a figure than it is for them to read through a lot of dense text in your results section. So tables and figures are a very good way for you to quickly and concisely convey what you found in your study. Be sure that they're not cluttered up with a lot of unimportant data. Focus on the most important findings of your study in your tables and figures. I hope you've enjoyed this instructional video, and we hope that it gives you a better submission process for American Journal of Critical Care.
Please feel free to leave comments for us in the comments section on YouTube.